everyone, and welcome to Talk Nerdy. Today is Monday, July 31st, 2023, and I'm the host of the show, Cara Santa Maria. And as always, before we get into this week's episode, I do want to thank those of you who make Talk Nerdy possible. As you've noticed, we have not been reading many ads this year. Ads have slowed up sort of industry-wide across podcasts. So more than ever, we're really relying on support from individuals just like you. We use a public model using Patreon. It's very similar to public television here in the US, or public radio like NPR or PBS. We're going to call it Cara's version of NPR or PBS. It is my Patreon page. If you are interested in pledging your support, all you've got to do is visit patreon.com/talknerdy to learn more. You can pledge on an episodic basis, and at a low level, I think it's like $2 an episode, something like that. You can get an ad-free version of the show. This week's top patrons include Daniel Lang, David J.E. Smith, Mary Neva, Brian Holden, David Compton, Gabrielle F. Jaramillo, Joe Wilkinson, Pasquale Gelati, and Ulrika Hagman. Thank you all so much. All right. So this week I had the opportunity to chat with Dr. Luana Marques. She's a psychologist at Harvard Medical School. She's also the director of the Community Psychiatry Program for Research in Implementation and Dissemination of Evidence-Based Treatments, or PRIDE for short, at Mass General Hospital. She also served as the first Latina president of the Anxiety and Depression Association of America. She has a new book out. It's called Bold Move, a 3-step plan to transform anxiety into power. So without any further ado, we're going to be talking mental health, kind of a little bit behind the curtain of the industry that is psychology, clinical psychology, and also, of course, anxiety with Dr. Luana Marques. Well, Luana, thank you so much for joining me today.
Thank you for having me. I'm excited to be here with you.
Absolutely. So we're going to be talking about your new book, Bold Move. We're going to be talking all about anxiety today. So before we get into the book itself, let's learn a little bit about you. You're actually a psychologist at Harvard, and you focus on, let's see. So the Community Psychiatry Program for Research and Implementation and Dissemination of Evidence-Based Treatments. That's a long title. So you guys call it PRIDE, at Mass General. So you're focused specifically on utilizing evidence-based treatments to try and improve client outcomes, yes?
That's absolutely true. So for the last 10 years plus, what I've done is really focus on a field called implementation science. In particular, how do I take evidence-based practices, in my case, cognitive behavioral therapy, and make them accessible to communities who often don't have access to this? And in my case, what we focus on, and from a personal and professional angle, is inner city communities. Because growing up as a Latina woman in Brazil who faced a lot of adversity and trauma, I felt strongly that those communities don't have access to good science. And so I spend a lot of my time training individuals in the communities who work with youth who are not psychologists. They're paraprofessionals. They learn the skills, not therapy, the skills themselves. They learned how to manage their emotions, how to have flexibility in their brains, and then they teach the skills to youth. And we've done this with young men coming out of prison, single mothers in poverty, inner city high schools. And that's really my passion, to make science accessible to all.
So kind of going to ask a little bit of an inside baseball question before we dive into, what your active work and what you've been writing about. But coming from Brazil and then training in the United States, you yourself said that you were very focused on CBT, so cognitive behavioral therapy, as your orientation towards treatment. And tell me if I'm wrong, but Brazil is very psychodynamically heavy, is it not?
100%. 100%.
So I'm so curious about your journey there.
Yeah. So, it's interesting because Brazil in psychology, and most of Latin American really, is very psychoanalytic trained. I was trained as a psychologist first, to be very honest with you, Cara, by my grandmother, who actually taught me how to challenge my thoughts and approach instead of avoiding. And when I came to the US and I was an undergraduate and fell in love with psychology, cognitive behavior therapy just made sense for my brain. But I'm going to tell you, people in Brazil didn't like it. My dad at one point said, "You need to go to analysis. I think you don't understand. It's better." I was like, "Well, it may be better or different, but this is the modality that my brain understands the best, and that's how I fell in love with it."
Oh, I love that. So full disclosure, and my listeners know this about me. So I'm finishing my PhD right now in clinical psychology, and I'm very deeply existentially oriented. So kind of existential humanism, social justice, and feminist psychology tend to be the places where I spend most of my time from a theoretical perspective. But that said, I utilize all sorts of approaches, and CBT is a common tool that hopefully all psychologists have in their toolbox. So I'm curious, kind of even before we get into some specific anxiety intervention work, how you sort of think about or conceptualize what we term evidence-based treatments within psychology. Obviously, some things are evidence-based because they're easier to test, and other things are evidence-based because, well, I shouldn't say some and other, but a lot of the things that we utilize as evidence-based treatments, we know they work because we've done great, randomized controlled trials on them. But part of the reason we're able to do that is because they lend themselves to doing randomized controlled trials, right?
100%. So, and if you look at the data, right, what we know is what's called the non-specific factors of psychotherapy account for a lot of the variabilities in the outcomes. And so I think you're right that there's a camp that would like to say that evidence-based treatments are only those that are randomized controlled trial and that that's really all that works. I personally, from a theoretical perspective, think that they're tools and they are really important tools, but I can't practice without conceptualizing the individual within their culture, understanding their community, understanding the systems where they live. And so in graduate school, I did sort of a bit of everything. I learned about, objects relation and attachment theory and existential. Like I tried to understand all schools of thoughts to develop my own approach to psychology, just sort of let me take this individual, understand where they're stuck and how do I help them get unstuck and what are the tools I have. And the last thing I'll say here is I very much appreciate your point that we cannot test some of the things that make people better because of the way the processes work. And what's most important in the day is that we're getting our patients better. That's what's important.
Right. I so agree. And I think it's also just an important note that maybe will resonate with some of the listeners who themselves have gone through therapy or have family members who are going through therapy, or some of the listeners who just happen to read up on this stuff and enjoy learning about psychology. But in practice, I like to make a kind of a firm distinction in my mind between what you mentioned, and you used the term conceptualization, how we think about our clients, how we think about their lives and their interpersonal relationships and their goals and everything that makes them who they are, versus intervention. So what we do with our clients, the types of treatments that we utilize. And one can conceptualize a client psychodynamically and use CBT interventions. And every combination under the sun is available. And I think it's important that we make that distinction because I even see in first and second year graduate students in my program struggling with that. This idea that, well, if I think this way, I have to only do things that fall perfectly in line with the way that I think. And I don't know. I don't think that's true.
I fully agree with you. It is not the way it's true. The conceptualization guides us to have a framework, but then you have to create specific interventions. And there are better interventions or more matched interventions depending on which level you are addressing with somebody. And I don't think there is a black and white answer, right? Sometimes I'm working with somebody, I worked with somebody for a while on treating something called complicated grief, and I use complicated grief treatment, the CGT approach. And then halfway through it, I was like, yeah, I think we need to do more of the interpersonal piece and really focus more on IPT. And we shifted. And I think this framework allows me to then shift the interventions and see where that person is. And rigidity in our thinking as a clinician is one of the things that gets us stuck. So I'm with you, like flexibility in approach and conceptualization allows for such much freedom in our work.
I love that. And I think so much of it relates not just to the person, their kind of temperament, your relationship, but also, like you said, where are they in the process? Is this their first time in therapy, or have they been doing this for years and years and years? And also, some diagnoses lend themselves to specific treatments. Like there are certain approaches to psychotherapy that we just know work when people are dealing with certain, severity levels or certain diagnoses. And specifically, the book that you wrote is about anxiety. But what are some of do you consider yourself more of an expert in sort of like mood and anxiety disorders, or where do you spend, most of your time clinically?
So before I even answer that question, you took the words out of my mouth. I was just going to say that too. Like literally, that when I was going through a major transition in my life and I sought out help, I didn't need cognitive behavior therapy. I needed somebody to talk to me about my emotions and listen to me and be present with me so I could process, right? Versus somebody comes to me and says, Luana, I'm having panic attacks and what I really need, what do I do? You need interoceptive exposure, in my opinion, because that really helps bring that panic attack down. Right, so I agree with you. So clinically, I am a strange kind of breed, so to speak, because what I figured out early on, Kara, it was that I wanted to learn as much as possible about treating different conditions. So today, on the day-to-day basis, most people come to me for either some form of an anxiety disorder or trauma, right? But I started early. I was an undergraduate and I was treating obsessive compulsive disorder. From there, I spent all my graduate training looking at romantic relationships and post-traumatic stress disorder. When I got to my postdoc, I worked in 2 separate clinics at Mass General. So I was in the anxiety program. So I did everything, GAD, PTSD, social phobia, generalized anxiety disorder. But I also worked in the OCD program. So I treated trichotillomania, skin picking, OCD, body dysmorphic disorder. And so, and it's just because I really wanted to figure out how to do it. And I just loved that. I could see 10 patients in a day. It would be like completely different types. And I just loved it. So long answer to your question that I'm weird because I sort of got trained to treat a lot of things that I think most people don't do.
Yeah, I love that too. I mean, just so that you know my frame and where I'm coming from. I'm finishing my PhD right now, which means I'm about a month away from finishing my internship.
Congrats, by the way.
Yeah, thank you. Oh my gosh, I'm so close.
We need to pause here. For those of you listening and understand this is a lot of work and a big combination. So congrats. I'm so excited for you.
Thank you so much. It's been a long time coming. I'm a career change student. So later in life, I will be earning all, so long as nothing gets in the way in the next month, which I don't think it will. I'll be earning my PhD. What is that? 3 months before I turn 40. Very proud.
Awesome. Congrats.
Yes. So my background, my practicum training was in I worked with foster youth, foster adolescents. So there was a lot of severe mental illness, some personality disorder, but really also just a lot of adjustment disorder, what I deem sort of normal reactions to abnormal life situations. And then I moved into where I plan to fully practice, which was psycho-oncology. So working in cancer and end-of-life work, which of course, as an existential thinker, like we were just talking about, certain modalities make sense for certain populations or for certain stressors. And so in working with people as they approach the end of life, the existential modality does seem to work, although I use CBT all the time with scanxiety, with panic disorder, with all of the other things that can come along with cancer. Right now, my internship is in an outpatient gerontology clinic. So some of that stuff I get to use, but also like you, I get to see all manner of mental illness, from the, severe mental illness to kind of the garden variety anxiety and depression that we often deal with. But yeah, so my frame is heavily in this existential place, but I'm so curious and I'm always so excited about understanding evidence-based approaches, especially to very specific complaints, because we just have such an incredible toolbox. I don't think any one trainee could learn everything there is to learn in psychotherapy.
Impossible. 100% impossible.
Right. So how do you do it? How do you keep that focus on, I want to know what's going on with these individual clients, and I want to learn what specific interventions seem to be the most appropriate for each of these, very specific chief complaints.
You're taking me back to my first day in my graduate school. I had this practicum professor who, sometimes somebody says something to you that just sticks with you. And he said, I remember vividly, he said, if you ever think you know 100% what's happening with a patient, you're out of your mind. And that's how you feel.
Right.
And so that's the thing that I'm always reminded, is that I don't know, and I need to learn the landscape of their brain. In some ways, we are the experts in of our brain. We live with it. We know that landscape. And I think my job is to help somebody peek behind the curtains of their own brain and bodies and learn and understand, like, what is the infection here? What's limiting your life? If we're able to get you better, what does that look like? And so I spend a lot of time just exploring with somebody their own conceptualization so that we can arrive at a joint, understanding of how we're going to do some interventions. And I also know my lane a little bit. So for example, I learned early on, Kara, that individuals with a type of personality disorder and specific narcissistic tendencies hated me as a therapist. And the reason they did is because I tend to be direct and I tend to want to get people better. And so I had to sort of sit with myself as a clinician and say, okay, what are my strengths as a clinician? What are the domains that I could work on, but they're not my strengths? And so I try to stay on my lane so that I can be the best self I can as a clinician when I show up. Does that answer your question a little bit?
It does. And I think it brings something, and I know, again, this is a little bit inside baseball, but sometimes it's fun to peel back the curtain. I think it brings up an equal and opposite important component, which is, you talked about sort of staying in your lane and saying, these are the places where I think I can be the most effective. These are the places where I can lean into my strengths. And the other side of that is, these are the places where I'm taking care of myself, because as a helping professional, like, there is such I don't want to say a tendency, but an opportunity for vicarious trauma. There is such a risk involved in very fast burnout, in really harming oneself. And it's so interesting. I tell people all the time, I work with people who are dying and they're like, how do you do it? I could never. And I'm like, I don't understand your point. Like, it's the only thing I want to do. But if I were to work with couples who are fighting all the time, like, that would exhaust me. And so it's so funny that different strokes for different folks, but we have to sort of know ourselves to know where we can be the most effective and where we can care for ourselves the best.
I think this point needs to be elevated and heard again and again, because I think especially for new folks in the profession, especially after the pandemic, I've seen this more and more with trainees, as you talked about, or early career folks who want to give everything. They're such in a mission-oriented stage of their career. And what I always say, and I remind myself, is if I am not in a place that I am feeling balanced and regulated, I can't help, right? And eventually we do burn out. I remember in graduate school, because I did mostly just trauma research, we talked about this a lot with my classmates, and it was like, there's a trauma amount that I could take on. And eventually I needed a break from just doing trauma focused therapy, because it's a lot. And so I scheduled my days different. I put patients in between. They were not trauma patients. I would take a few days off from seeing patients and really understanding self-care as a means to care for others. And I think you're very right. I don't think we practice it enough, but I think it becomes a hidden superpower if you do it well.
Right. And I think it applies to people in other professions, people in their own internal dynamics. Like, how often do we tell moms when we're working with moms that they have to put on their mask before they can put on their kids' masks, right? That standard, airplane metaphor, yet we don't always apply it to ourselves. And you're 100% right. How can I possibly help somebody else? Let's say, extending the metaphor, breathe when oxygen is low if I'm not breathing and my own brain is being affected by that.
I love that you pushed this metaphor because I had never actually thought about it this way. But think about what not breathing does to your brain. You can't focus, right? You can't actually think critically. And so literally, I never had pushed the metaphor all the way out, which is if we don't put the mask first, we actually will stop thinking critically and not be able to help at all. And so I love that vision of that is the only way. It's not an optional way to help others.
Oh, 100% agree. And I know I'm taking this down a rail, but like I was just talking to a client recently, and one of the conversations we were having, they were upset with themselves for having a day on the weekend where they did nothing. And they were like, oh, I felt so useless. I just collapsed on the couch. I just played video games and watched TV. And I didn't accomplish anything. And I remember having to have this conversation that like, not only is rest not a reward, but it is prophylactic. Like we require rest. Like just as human beings, we need to rest. If we work every waking moment of every day, it is not healthy. And it's so sad that we've sort of developed this mentality that somehow we are, I don't know, failing if we take care of ourselves. What a world.
No, I think it's so important because the world tells you that if you're not at 100 all the time, then there is something wrong with you. And then our brain, of course, talking about science, right? Our brain doesn't like discomfort. So if you have a belief already that maybe I'm not so good or something is wrong with me, and then you take, and you want to rest, now you're proving that something is broken with you, which creates even more distorted thinking. And it starts at the individual, but is exacerbated by society. And I share this message all the time. I said this to my husband today, actually. I talk about charging up as a skill and the idea that, movement is important. But when I think about charging up, I literally see a gas tank and I have to think about where my gas is and what I can do. And sometimes charging up is taking a nap because that is what my brain needs. Sometimes it's going for a walk. But I think we need to get to this habit that taking care, resting is actually giving us fuel as well. And that we need to honor it. I said this afternoon. I was like, oh my God, today I'm going to take a nap. That's what I need. And I did it before this interview. And I have to tell you, I feel so much better and present with you.
I love that. So speaking of, obviously your book, Bold Move, you focus on a 3-step plan for kind of handling anxiety and really using that anxiety in a productive, or maybe I shouldn't even say productive, but in a way that is beneficial to the individual. So I'm curious if we can dive in a little bit about I don't know, maybe some of your conceptualizations of anxiety and how you think anxiety can actually be transformed.
Everyone I've ever met that wants to work with me who is in the anxiety spectrum, the first thing they want to ask me is, how am I going to get rid of their anxiety? Right? Just tell me how we're going to get rid of this anxiety. And here's the first thing I tell everybody: I cannot get rid of your anxiety completely. There's just nothing I can do. And I can't do because in some ways, anxiety comes from our fight, flight, and freeze. It comes from a response of our brain, which is designed to do two things, right? Protect us and predict the future. And whenever our brain senses danger, even if it's a false alarm, we then get on this fight, flight, or freeze, which is a lot of the experience of anxiety today. It's this heart pounding and sweating and dizziness. And when we feel that, we start to interpret it as something bad is about to happen. Then we have all those thoughts related to the anxiety. And so, I can't stop that from happening. What I can do for people is teach them what is really getting them stuck. And what I talk about the book and believe deeply, and in fact, my life has changed because my grandmother was the first one that pushed me to understand this, is that the real enemy here is not anxiety. The real enemy is what I call psychological avoidance. It's what we do when we're anxious. And for many of us, what we do is we walk away from whatever it is.
It's interesting, this idea that the behavior as linked to the experience is so much more impactful, meaningful, affects more change. It reminds me, I've been working on my dissertation, and I was lucky enough to interview individuals who are electing to die with medical aid, and talking to them about their experience and making that decision, and going through the steps in the process, what's working, what's not. So it's kind of a phenomenological, qualitative dissertation. And one of the things that I grapple with in my discussion is this idea of suffering. And, reading a lot of philosophers and different incredible psychologists, I quote an individual as saying that suffering is not pain, disability, nausea. Suffering is the perspective that we have on those things. So kind of like they said, if somebody loses a leg, they have to have their leg amputated. That's going to mean something very different to a lifelong dancer than it is to, they say, an armchair psychologist. And I think about that quote very often because I see huge parallels with what you're talking about. It's not so much the internal experience, the somatic state, even the feelings, but it's how do we interpret those things, and then what do we do in response to them?
I completely agree. So Pema Chodron talks about not transforming pain into suffering. And she talks about, things like getting your leg amputated should cause you some level of pain, but it's your interpretation of that pain that gets you suffering. Right? It's how you make meaning of it. And I think you're absolutely right. So for me, when I have my heart pounding, what it means to me is I'm excited or maybe a little nervous. For a lot of people I work with, for them is my heart's pounding and that means I'm having a heart attack. And so that experience becomes so difficult that then they start to avoid anything. They stop having sex. They stop drinking coffee. They stop going to the gym. And the problem is that avoidance only reinforces their anxiety and the interpretation that a heart pound is bad. Often somebody that has panic disorder, for example, that I'm working with, in the past, they loved coffee, but now coffee is bad. And that maintains that avoidance and really is what gets them stuck. It's not the experience of the anxiety itself.
Oh, what a sad thing, too. I know you've probably seen all those memes on like Instagram and places that if you cut out your morning latte, you can remove what little joy you have left in your life. It's like such a sad thing to think about. And, it reminds me of like in CBTI, right? CBT for insomnia. One of the things that's often talked about is this clock watching problem, or this like trying to force yourself when you're not going to sleep, you're not going to sleep. Like just get up, do what you were going to do. And I think that's counterintuitive to a lot of people because they think that just looking at the clock over and over and just laying there and going, please sleep, please sleep, please sleep is actually beneficial, when I think you're right. It just reinforces that negative loop.
Yeah, I mean, the thing is, I love this piece of sleep hygiene from CBTI because often we are like, well, if I just look at it, then it's going to be okay. Or, but what happens is it's midnight. Oh my God, now I'm not going to get enough sleep. It's going to be horrible. Oh, it's 1:00. My day is ruined. I have that big meeting. The thing that I think we need to know as a society, just understand the thoughts are not facts. But our limbic system and our amygdala in particular can differentiate a lion from a thought when it comes to thinking there is danger. And so by just saying to yourself, I'm not going to sleep, I'm not going to sleep, you're not going to sleep because your brain's hearing danger, danger, danger. And so you're right. As a technique, if you're not if you haven't fell asleep in 20 minutes or so, get out of bed. Don't look at the clock. Go do something soothing. Try again later. And really, that helps. That's usually what gets people unstuck.
Yeah. I'm curious about, and this is such a hard question, right? We talk about nature and nurture. We talk about temperament and personality. We talk about how much who we are as people and our approaches to, let's say, stressors or conflict is shaped by, how we're raised, is shaped by our culture, by our family, all of those different things. But I am somebody who I've always characterized myself this way, and maybe it itself is also a self-fulfilling prophecy, but as a person, so as a patient, not necessarily as a clinician, but as a client, I am somebody who tends towards depression, not towards anxiety. And I know there are a lot of people with mixed presentations. There are people with neither, with both, with either. I take an antidepressant every day and have for many, many years, but it was mostly because of, a melancholy, classic kind of persistent depressive disorder presentation. I have never been somebody who spins out when the shit hits the fan. I've never been somebody who can't remain calm in really tense situations. So I'm that friend, right? I'm that person who's like, Kara's calm, she's got this. And I'm just curious, how do you communicate with individuals who are like, why am I like this? It's one thing to talk about how I can change my approach and my behavior, how I can work towards being different or towards softening, I guess, my anxiety. But why am I like this to begin with? And why are some people not like this?
I know. I think there is, in that question, before I even were to answer that question to somebody, the first thing I'd say is, what do you mean by being like this? What does it actually mean for you? Right? Because if you really think about her, they're saying something more than I just tend to fall in the depressive range. Right? What does it actually mean? So if I was asking you, like, what does that mean for you when you say I tend to follow? Like, what about that is bad, or what does that mean?
Right. Right. Yeah. It's interesting because I think you're right. Again, I've done a lot of work, so I make meaning in places where I maybe didn't in the past. But, I have a very social justice oriented and existential view that like, I just see things for how they are very often, and how things are pretty horrible. And so sometimes I have what I believe to be a normal response to a difficult world that we live in, right? Structural inequities, climate change, a lot of really terrible things. And I tend to be sad about those things. And so my kind of general disposition is not, let's say, saccharine or falsely rosy. I think I have like a very authentic disposition, but that disposition is looking at the reality of the situation we're in. And that's my perspective. Of course, everybody's is very different. But I think because of that, I also, there's a good example. I was recently on a trip with some students from my school. We went to Southern Africa to do some work in a small country called Eswatini, which has a lot of systemic problems. And I remember being on the bus, and one of the women on the trip couldn't find her passport, and she was like freaking out. She, oh my God, where is it? Where is it? We're like, we know it's here. And like, if we just breathe and we remain calm, we'll be better at finding it. But the minute we start spinning out, we're not going to see it, even if it's right in front of our face. And that's just always been how I approach problems. But I'm sure I learned it somewhere along the way.
Yeah. I mean, I think there are a few things that, you're saying a few things that are important here, which is, for you, what I hear you saying is I tend to face reality without putting filters on, and reality is tough. And so I feel those emotions, and it could be temperamentally, the way you were born, genetically temperament. There is this piece of feeling those feelings in a more intense way that can steer you towards depression, right? And so I grew up certainly as an anxious kid, but I didn't even know it was anxiety. As a kid, I used to have horrible asthma attacks. My mom would rush me to the hospital. She'd come to school, grab me. It was a public hospital. And like, she tried to cut the line. And like, I remember vividly those asthma attacks being horrible. It wasn't until I was writing Bold Move that one day at 4 a.m, I was writing about the correlation between anxiety and the symptoms showing up in our bodies. And then I had this moment that I was like, oh my God, as a kid, I was having panic attacks. Those were not asthma attacks. And the way I got there is because there was a lot of domestic violence in the home, and those attacks always came after my father and my mother had a horrific fight. And so once they broke up and my father was out of the house, my asthma disappeared. Right. And so I share this in the context of like, today, I don't say I'm an anxious person, but I tend to run in the anxiety spectrum. And because of my training and where I am, what I tend to do is my avoidance flavor is overdoing it. So I catch my own anxiety when I'm like having taken on 5 new projects and I have 6 speaking gigs. And, from like, I'm going to do for my book lunch, I did 20 podcasts. I'm like, okay, what you're avoiding, Luana? And I was like, oh,
right.
I'm avoiding my fear of failing. I see it. Right. Like, and so all of this to say to people is like, I think we do fall in a spectrum. I tend to see people fall more on the depression or the anxiety spectrum, but because biologically or temperament we fall there, we don't have to stay there all the time. And we can use some of the things that you and I are talking about to, find a way to use that temperament to actually propel you. I think that's why, I put the subtitle of the book on transforming anxiety into power, because I wanted to just call it avoidance. And everybody's like, but everybody's anxious. I said, but anxiety is not the problem. It's what we do. And, I just want people to learn that, like, you can have anxiety and use it to transform in a way that you're going towards your dreams and the life you want. And that's what I do in my life every day, Cara. That's what I do.
I love that because it is true that there's a reason, for example, that we feel pain. And there's a reason, for example, that we experience anxiety or even fear in certain settings. And that experience is a signal to us to change our behavior. Of course, as human beings, like we can go back to Robert Sapolsky and why zebras don't get ulcers and all of these conversations about how the human experience is very, very different than our evolutionary cousins because of all of the strictures that we've sort of developed, these sort of artificial strictures around us. But it is interesting that when we get back to this deep, I don't know, exploration of that feeling of your heart palpitating and maybe you're sweating or you're shaking. It's different for every single person. That just like you said before, that you had to train yourself to, I think I maybe more naturally or maybe didn't realize when I was young that I was training myself to do this. I feel excited when that comes up. I see that as a new thing, yay, fun. Whereas some people see it as, oh my God, horrible thing, must get out of here, I'm going to die.
That is so true. And just that interpretation either leads to more anxiety or quiets down the system. I'll share one more personal example. Today, I was in New York yesterday for an event. And so I took the train back to Boston early this morning. And I was in the train and my heart started to pound a little bit. And my brain went immediately, why are you anxious? There's nothing to be anxious about today. And then I paused and I was like, am I really anxious? Instead of like feeding it. And I was like, no, I'm just actually really tired. That's what I am. It was a really long day. And just shifting that allowed me to settle. And I just closed my eyes on the train and took a little nap. And then I was back to feeling okay. And so I think, to your point, how we interpret what happens in our physiology and our bodies can really make or break our experience of even anxiety, and I'll push it, even depression, right? Because if you're talking about just feeling hopeless all the time, well, you're going to feel more hopeless. There's no way around it.
Absolutely. And I think what's interesting is that on the flip side, and of course, this is the ultimate takeaway here, when we can use that somatic experience, that internal emotional experience, almost as fuel or as a source of meaning making, it can positively affect our growth and change. And obviously, in just a second, we'll be talking about some of those examples with regards to anxiety. But just like you pushed the metaphor, I personally think that my own experiences with depression make me a better therapist in working with people in very difficult parts of their lives, because I just have this calm, quiet, reflective sort of temperament. And I think I've always been that way ever since I was a child. I was never very up. I also have a sleep disorder, which makes me tired all the time. And I think that also neurologically contributes. I apparently have very low orexin. And so I don't have a lot of wakefulness neurotransmitters in my brain. But you combine those things, and I can sit in silence and I can sit in slow, contemplative conversation. And I find that that feeds me. And I feel very comfortable in those settings. But for some people, it's incredibly uncomfortable to sit in that way. And so this goes back not only to the thing you said at the beginning about know yourself, so that you know how to use your gifts, and you're leaning into the gifts, and you're minimizing the pressure on the parts of you that are stressed or bound to break. But I think it also goes to exactly what you're talking about. Like, once you recognize these feelings and you reinterpret them, you can use them for the benefit that they offer you, because there is good sometimes, even in the sadness or the anxiety.
I couldn't agree more. I think that they are indicators for you of an action is going to have to be taken. And I don't mean just a physical action. Sometimes the best action, which I think is everybody's superpower that often people don't use, especially in the anxiety spectrum, is to just pause and observe what's happening. Just like literally, to your point, sort of contemplate and observe the experience in your own body with curiosity, so that you have the potential of change that relationship. So often we push to just get to comfort somehow. And that's why I see people avoiding the most. I think, Cara, that the way to help all of us grow is to embrace a comfortably uncomfortable life, that we allow discomfort to exist without having to change it immediately, that we are able to sit with pain, but not transform into suffering, right? Because we don't have to. And I think contemplating can really help there.
I love that so much, because I think it speaks to not only tons of different Western psychological modalities and Western philosophies, like obviously there are CBT approaches that do that, there are mindfulness meditation approaches that do that, there are existential humanistic, there are even psychodynamic approaches that grapple with that. But it really is a recapitulation of a very old lesson that Eastern philosophers and Eastern practitioners have been teaching us for hundreds of years. We can look back to Zen Buddhism, and these are, traits and concepts that we've been grappling with for a very, very long time.
I agree. I to your point now, and to this conversation, I think is this integration of different philosophies and being able to then sit with somebody, see them fully, and then help them see themselves, that really unlocks potential for the human being. And to do that, we have to be able to be uncomfortable. We cannot, there is no comfort. I was actually with Dan Harris from 10% Happier. He was doing the book signing with me in New York 2 days ago. And he said, the first thing that happens when we sort of pause and we look at it is that we realize how much shit there is in our brain. And you have to have a level of humility to just sit with that. And I agree. But once we do, life is so much better.
Yeah. I'm curious from a sort of operational perspective, because of course, part of what you did in your book, which I think is very important, especially for individuals who are interested in knowing themselves a little bit more, introspecting more, becoming more psychologically minded, is to grasp some of these concepts less in an ineffable philosophical way and more in a very tangible, action-oriented way. So one of the things that you do in your book is you talk about this as a 3-step plan. You sort of codify it in that way. So I'm curious if you could share with us specifically how you broke this up and sort of made it operational.
Absolutely. So the book starts basically with the idea of psychological avoidance. And once people are able to understand their pattern of avoidance, and I have never met anyone, me included as I share, that doesn't have some kind of behavior avoidance that we engage in. And so once we know it, then I talk about the 3 skills, which are shift, approach, and align. And the way I do in the book, and I know that your listeners care about science, so I want to pause on the science a little bit, is that I talk about how we're getting stuck. So in Shift, for example, we are getting stuck on our thoughts and what we are saying to ourselves. I, for example, often got stuck on the belief that I'm not enough. As a little kid, I couldn't save my parents, I couldn't save the marriage, therefore I wasn't enough. And what we know from neuroscience really is that our brain hates dissonance, so wants to prove our distorted beliefs again and again. And so in the Shift chapters, I talk about here's your thinking, here's how you're getting stuck, here's the science behind of why you're getting stuck. And then to your point, I teach people really skills to get them unstuck. For Shift, I talk about this idea of observing our thoughts and changing them, not replacing it, but looking at it in a more balanced way. Or to make this very concrete for our listeners today, talking to yourself as if you're talking to your best friend. Because I would never say to my best friend, you're not enough, you suck, you're not smart enough, right? We just don't do
Right.
that. And so in Shift, I ask people to identify their thinking and start to shift their perspective. Is that sort of the depth that you're hoping I could cover the skills?
Yeah. Yeah, I think so. That makes sense to me.
Perfect. So I can just share briefly the next two then. Approach is the idea of going towards discomfort instead of running away. The skill here is called opposite action. So imagine that you have some anxiety about dating. I certainly did on my single days. And what you want to do is just cancel the date tonight. What would be opposite to completely canceling that date? Could you text with the person? Could you have a video call? Could you agree to a shorter date just to go for a walk? But here I'm trying to train people's brains that we're perceiving dating as a lion, but that there is no lion. And so the idea is to approach instead of avoid. And finally, I talk about align, which is living a values driven life. And this skill to me, Kara, has been really transformational in the last year or so. When I hit a wall professionally, what I was doing was no longer working. I just kept doing same thing more and more and thinking it's going to be different. And it wasn't until I realized that my core values had changed and that I needed to change my actions to align with them. When I finally committed to doing it, I can tell you, I feel so much better. And so that's the premise behind Align. Is like, can you align daily actions with the things that matter most? Because we know it makes us less anxious, less depressed. It makes us feel better.
I love that. And I think it also reinforces, for me, kind of approaching these things in a strengths-based way. Like we can very often talk about the pathology or the diagnosis and talk about how do we reduce the symptoms or how do we improve the, complaints. But there's the other side of the equation is how do we make more space for the good in our lives? The things that are working, how do we amplify those things? And so I think that speaks exactly to that approach that I find so meaningful, which is, what is it about yourself that you believe, that you're proud of, that makes you want to get out of bed in the morning? And how do you lean into that and reflect on that more? Because that's just going to facilitate a more joyful life.
100%. Values are like a clean fuel. Once you lean into your strengths and the things that you care about, then you burn easier and it brings you more excitement. And I personally feel like it just gives me the ability to be more resilient in the moments of stress. To your point earlier, I don't spin. I go, I'm doing this because it's value driven. Let's go do it instead of spinning out of it.
Right. No, I love that. So listen, Luana, there's so much more we could talk about. And I hate that I have to keep us, honest about time simply because our own schedules require it. But I always close my episodes by asking my guests the same two questions. Before we get to that, very brief segment, I'm just curious, is there anything that we haven't touched on that, you want to make sure that we discuss today before we move on?
No, I have found this conversation to be so, so exciting. I love your insights. So I don't feel like there's anything else we need to cover.
And I feel the exact same way. I feel like I've learned so much from you. So now I want to learn more. And these questions are a bit personal. They can be deep. They don't have to be, but they're sort of big picture questions. So I feel like I always have to apologize at the outset for putting people on the spot, but take as much time as you need. I'm curious. When you think about the future in whatever context is relevant to you, so it could be, regarding your work, it could be regarding your family, you individually, your community, your society, even our global kind of community. I'm curious, number one, what is the thing that has been keeping you up the most at night? The thing where you are legitimately, frustrated, struggling, maybe you're dealing with some pessimism or even some cynicism. And then, of course, on the flip side of that, so that we do end on a more positive note, where are you finding your hope and your optimism when you look to the future? What are you sort of genuinely looking forward to?
So the thing that keeps me up at night, they're so interrelated. I don't think I can separate it. Is really the youth mental health crisis. I think we have a mental health crisis, period, but the youth mental health crisis and the lack of skills for kids that they don't get anymore. I think there's a shift I've seen in the world as we get busier and busier. Parents get busy and busier. We are farther and far away for the nuclear family. Some of the things that we may have learned about regulating emotions or being present, they just don't exist anymore. So there's a deficit in skills, and the youth mental health crisis keeps me up at night tremendously. And then I'd push that even further. The mental health crisis for people of color and minorities and in poverty communities, that to me is unacceptable. Unacceptable, because the reality is, I would get too far on this. So that's what keeps me up at night. The third thing that keeps me up, sorry, I'll have tried one more, is that, and I guess that goes to fixing it, which is this, at least at a basic level, Kerr, CBT cannot fix everything, but at a basic level, they are applied skills that if we could teach every kid in schools, for example, or in their community centers, we could bring down the temperature of emotional health. And so that the fact that we know there are some things that are basic, right, that kids don't get, like that to me is upsetting. What makes me really excited these days is that personally, I feel like in the last 2 years of my personal career, I went from this journey of like being a hard academic, doing randomized control trials, then getting out of the ivory tower and moving all my research to student communities, working with nonprofits, to now shifting my own career to a more public-facing author and speaker. I've got a lot more traction now on getting the skills to a lot more people. And so I don't think alone I can do it, but I think in opportunities like this with you, I feel so honored, because it feels to me like everybody's getting a little dosage of an antibiotic that they don't even know they're getting it, right? Because my dream is like, can we get science into the water when it comes to mental health so more people can have access? And opportunities like this to speak with you and disseminate at a broader context to the person sitting at home listening to us, that just gives me hope and gets me excited, and I get to learn a lot. So that's what gets me excited these days.
Ah, so beautifully put. Science in the water. I love that so much. Well, gosh, everyone, the book is Bold Move, a 3-step plan to transform anxiety into power by Dr. Luana Marques. Luana, thank you so much for being here with us today.
Thank you for having me, Kari. It was really a pleasure.
It really was. And everybody listening, thank you for coming back week after week. I'm really looking forward to the next time we all get together to talk nerdy.